I'm Tim Key. I'm the Director of Occupational Medicine at UAB. I'm also the Executive Director of Research Safety at UAB. And I'm here today to talk about high blood pressure. Hypertension in the United States is a major health problem. Approximately 100 million plus people have high blood pressure in the United States. There are around 1,100 deaths a day related to high blood pressure or the consequences of high blood pressure. So it is a major health epidemic. So what is blood pressure? Blood pressure, if you think of your plumbing system, it's what keeps the blood flowing around the body. The heart pumps the blood out. That's going to be that top reading, that 120 number, also known as systolic. The lower number, the 80 number, is diastolic. You can think of that as the heart's at rest. That's what the normal pressure of the system is. And then that higher number is when it's pumping the blood throughout the rest of the body. So, what do we look for with high blood pressure? The American Heart Association in the fall of 2017 changed the numbers so that anything above 120 over 80 is going to be high blood pressure at this time. We used to say it was 140 over 90. There's also that middle ground of the 120, 140 range. But certainly anything where you get consistent readings that are above 130 over 80, you have high blood pressure. So why is it important to even know about that? Besides the numbers that I gave at the very beginning, it affects different parts of the body. Certainly, if you think of it as the heart as a pump, it's going to affect that pump. The harder it has to work, the more prone to failure that pump is going to be. There are other consequences of it as well. The arteries, the vessels involved, they're going to have to maintain a certain pressure in order to sustain the blood flow throughout the body. So you're going to run into problems with those arteries hardening up as well as being too elastic and giving way. Strokes, we've all probably heard of someone that's had a stroke. There are two different types of strokes. There's one where you actually blow the blood vessel and you leak out. The other type of stroke is where you block the blood vessel and then you just don't get the flow to the rest of that portion of the brain. Heart attacks, those are generally going to be from blockages in those arteries that supply the heart, the coronary arteries. Kidney damage, the kidney's the major filter for the body. And so if it's having to undergo certain pressure ranges that are going to be very high all the time, it's not going to function in its filtering capacity the way that it should. It eventually starts breaking down, starts leaking, and you're not clearing out the toxic waste that you should be. Blindness, there again, it's mainly going to be from the hardening of the arteries into the blood vessels that supply the eyes, and you start having blockages, you start blowing vessels, and you start having blank spots where you've lost that vision. That's not going to come back. So getting down to that blood vessel again, you can see on the left side, that's a normal blood vessel. You can see on the right side that you've got a restricted area. Well, past that restricted area and before that restricted area, the blood flows are going to be vastly different. And if you've got some blockages in there with what we call the cholesterol buildups, the fat buildups, if they're under such pressure that they're giving way and fragmenting at different times, then you're going to have blockages that are from the fat deposits themselves. And that's going to cause that blockage that leads to major damage past where the blockage occurred. So, what do we look for when we think about problems with blood pressure? Well, unfortunately, for most of the time and for most people, There are no major signs and symptoms until it's too late and the damage is done either to the kidneys or to the heart or to the brain. If you've had a stroke, it's too late. If you had a heart attack, it's too late. If you're going to have to go on to the dialysis or to the kidney transplant because of high blood pressure, it's too late. Those organs have already been damaged, and the repair is not going to be readily available for you. So, what can you do? Well, most of us, we'd have to change our lifestyles. Have to get into a weight that is going to be appropriate. We have to eat better, reduce our salt intake. You need to get exercise. The recommendations nowadays are at least 30 minutes, 3 times a week. It would be best if you could get up to 150 minutes. And it can just be a simple walk around the neighborhood. Stress management, none of us have stress. But if you think, again, of the heart and the arteries and the blood vessels being a closed system, a closed pumping system, you put any stress on those and you're going to have problems with your blood pressure. Eventually, most people will end up having to take blood pressure medication. The important thing is the blood pressure medication that works is the blood pressure medication that's taken. If you have trouble with taking your blood pressure medicines because of side effects or other issues that go on with it, talk to your doctor. There are hundreds of different types of blood pressure medication combinations, and they're going to be able to find the right one for you. So work with your primary care provider on finding the right combination for you. So in summary, one more time, when you think of blood pressure, anything 120 or 80 or less is going to be normal. You're in the good category. You're good to go. Anything in that 120 to 90 range, especially on the bottom number being between 80 and 90, you're going to be in that first stage of high blood pressure. You need to make those lifestyle adjustments. Give it about 6 months. If it's not improved, then you need to see your primary care provider. Certainly, if you're having readings above 140/90 consistently, you need to go to your doctor then and probably be started on blood pressure medication along with making those lifestyle changes. Anything over 180/110, you need to go to the emergency room as soon as possible so they can get your blood pressure down safely. Any questions?